Welcome to the program. I'm your host, Neil Howard. Glad that you could join us this evening. We're in conversation with Dr. William Kassler, and he's joining us to talk about protecting mental health during a pandemic. Now, mental health, protecting our mental health is important every day, but under these circumstances, protecting our mental health might be a little bit more difficult than we have found it to be in the past. Welcome to Health Professional Radio, Dr. Kassler, and thank you for taking the time.
Thank you for having me, Neil.
Now, I understand that you're joining us as Deputy Health Officer and Lead Population Health Officer at IBM Watson Health. Is that correct?
That is.
So what do you do as Lead Population Health Officer there?
So I'm a primary care internist by training. I'm a public health doc, and I actually got my start as an infectious disease epidemiologist at CDC. It does come in handy these days. Absolutely. And so I'm helping IBM and Watson Health work through the pandemic, the COVID response, and help our employees and help our clients.
Now, I understand that the virus takes a serious toll, far worse than any of the flus that we've encountered in the past decades. There is a lot of stress. There's a lot of anxiety, a lot of uncertainty for veterans, older folks, and people who are just on edge because of the situation.
Well, we are all, as a country and globally, dealing with circumstances that we haven't seen in over 100 years. We're all worried about the pandemic itself, about the infection, our safety of ourselves and our loved ones and our colleagues. And we also have to deal with the serious economic disruption of widespread shutdown and social distancing. And then we are all social creatures. Humans are very social by nature. And so the social distancing and the isolation can cause problems as well. And that causes problems for all of us. We're all dealing with working from home and our kids and the disruption. But for people that have underlying mental health issues, depression and anxiety, that's particularly bad, as it is for our elderly who are socially isolated and at risk for loneliness because of their lack of mobility and isolation.
Every day we hear about the dangers of, as you said, underlying health conditions. Let's talk about mental health as an underlying condition as it relates to the pandemic and maybe not getting the help that you need both mentally and medically because of your mental health condition.
So it turns out mental health is incredibly common. More than 1 in 5 American adults suffer from some form of mental illness. And yet over half last year didn't get the treatment they need. Part of that is due to the stigma of mental health, and part of that is due to the lack of providers and the challenges of being insured and covered for that. So IBM, long before the pandemic, was beginning to address that and issuing some key reports about how we as an employer can help. And we think that technology has an important role.
Technology as far as telehealth, how can technology help with mental health? We're all aware of how it can help with our physical health, respirators, ventilators, things of that nature. But when it comes to mental health.
So let me be clear. Technology is not for technology's sake, but technology can be an important tool both to make it easier for mental health providers to adapt to the remote communication without sacrificing privacy and security, but also to make it easier for people to access care and to overcome the barriers. I like to think about technology in mental health in several broad categories. First, there are mobile health apps on our phone. There are online platforms. There are telehealth remote visits and hotlines. And then technology can help with the care coordination to get individuals the care they need and address their social and mental health needs.
You mentioned we as a species being extremely social. What are your thoughts on people who are at a high level of stress and anxiety now for obvious reasons, but as we hope we're going to get back to some semblance of what used to be normal, what about folks that get stuck mentally in this time and they can't alleviate some of the stress even when the situation changes?
So I like to think about 3 concepts: fear, resiliency, and self-care. Fear is that signal, that fight or flight signal that says, pay attention, something is happening, something is dangerous. And that causes a surge of adrenaline. But if that continues, that causes stress and anxiety and actually is harmful and decreases our performance. Resilience comes in as an ability to bounce back from trauma and adapt to these difficult circumstances. And resiliency is not something that we are born with. It's something that we can build like a muscle through self-care.
Is resilience, building that muscle, is that something that can be taught while dealing with a mental health issue such as bipolar, PTSD, schizophrenia?
Absolutely. Resiliency is a skill that can be taught in people that are struggling without mental illness. It can be taught in folks with post-traumatic stress disorder or other diagnoses. It's not particularly complicated. It ranges from things that we can do ourselves, like being grateful every day, by having a sense of purpose, by reaching out and maintaining social contact, even if we're physically distant. And then it can also involve counseling that helps us to reframe negative experiences in a positive way, to find the silver lining in the cloud. And typically counselors can help with that.
Let's talk a little bit about some of our veterans, both from old conflicts and some of the recent in-country activity, who are, for lack of a better term, switched on right now. They see a situation, or we see a situation that is reminiscent of, pack it up and get ready. That causes a lot of stress, and especially when you're not in a combat situation, but all of your instincts tell you that you need to conduct yourself that way.
Indeed, combat can be hugely stressful and can leave hidden scars in our psyche. But not only combat, but our first responders or people that suffer from domestic violence can all have post-traumatic stress disorder. So we have a platform called GRIT, Get Results in Transaction, that can help individuals with post-traumatic stress disorder cope. It's not one simple thing. There are many things that need to occur in order to help someone with PTSD. One of them is by addressing some of their other stressors in their life, like employment, like we can link to employment agencies and help get people jobs. We can provide peer support through the social media aspect of this. So a veteran can invite friends and a squad member to help with talking about things that only people with shared experiences can understand.
Is there something comparable to GRIT in the civilian world, or can it transition over into the civilian world and give other folks those opportunities too, hooking them up with job information, mental health exercises and things of that nature on their mobile app as well, on their mobile devices as well?
So absolutely, there are a number of different mobile apps. I like to think about this as the wild, wild west, the good, the bad, and the ugly. There are just hundreds, if not thousands, of mobile apps to help people. Some of them are really good. They're science and evidence-based. They're curated and have privacy and security settings, while others are not. So it's really important, and that's one of the things that IBM has been stressing in its reports, to carefully curate and select those technologies that will work and that will be safe and effective.
You know, our listeners would like to get some more information about you, about IBM Watson Health, and also about GRIT. Where can we go and get some information about GRIT and the other things that IBM Watson Health is involved in?
So we'll be happy to share you links on our website to GRIT, to Teatros, which is another technology. It's an online platform that builds resilience and deals with post-traumatic stress. They have counselors. They use artificial intelligence to help provide the counselor with personalized insights to tailor that counseling. So we're very happy to share those links.
Well, Dr. Kassler, I thank you for joining us here on Health Professional Radio. I know that 10 minutes is not a lot of time to cover such a vast and important topics as mental health, especially during this time of pandemic. I appreciate you coming and talking with us today, and hopefully we'll get a chance to talk again.
It is my pleasure. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.